Is a presentation on fracture by Courage and Angelica. Joshua is a 21-year-old guy who likes to party. One night when he was about to go home, he was driving while it was snowing hard. Suddenly, his car flipped to the side of the road, causing it to flip over. Luckily, he was able to get out of his vehicle and called 911. He got some minor bruises, but his right ring finger started to get swollen and painful. So when the emergency responders arrived, they transported him to the emergency department to be assessed. Before going back to look at our guy Joshua, let's take a look at the normal anatomy of bones. Bones are the strongest and most sturdy connective tissues found in the body. Bones are composed of both organic and inorganic components. The organic components of bones include cells and osteons. Bone cells include osteoclasts, osteoblasts, osteocytes, and osteoprogenitor cells. Inorganic components of bones include mineral deposits, mainly calcium. Bones have four main functions. These include movement and support, protection of vital organs such as the heart and lungs, which is protected by the rib cage, hematopoiesis, which is blood cell formation, and mineral storage and energy reserves, mainly calcium and fats, which are stored in the bones. Bone is made up of 5 different types of tissues. These include blood, bone, cartilage, fat, ligaments, and tendons. Bone is an active tissue that constantly remodels its structure, and this is thanks to the 4 main types of cells that make up the bone tissue. These include osteoprogenitor cells. These are stem cells that can become other bone cells. Osteoblasts are building cells that secrete material for the mineralization of bone. Osteoclasts are bone resorption cells. They break down bone and release calcium, which can be absorbed by the body when needed. And osteocytes are mature bone cells. They maintain the structure of bone and regulate bone remodeling. There are 2 main types of bone. Compact bone forms the dense and tough outer layer of bones, and they are made up of subunits called osteons, while spongy bone is the lighter and less dense part of bone. It consists of branching plates called trabeculae and can be found inside the bone. In flat bones, compact bone makes up 2 of the outer layers, while there is a sandwich middle layer of spongy bone. While in long bones, compact bone makes up the outer layer and spongy bone makes up the inner spongy layer. The body comprises of different shapes and types of bones based on their locations and functions. Examples include long bones like the femur, short bones like the patella, flat bones like the scapula, and irregular bones like the vertebrae. Bones are a strong and sturdy tissue, but in the case of a fall or an accident, they can break, and a breakage in a bone is called a fracture, like was in the case of our guy Joshua. Signs and symptoms of fracture include bruising, pain, immobility, and swelling. Fractures can be classified in different ways. Firstly, by the position where the bone ends after the fracture. In this case, there will be a displaced or a non-displaced fracture. Secondly, by the completeness of the break. Based on this, if the bone is broken through, the fracture is a complete fracture, and if not, the fracture is an incomplete fracture. And thirdly, by whether the bone penetrates the skin. If so, the fracture is an open fracture, and if not, the fracture is considered a closed or a simple fracture.
We included several types of fractures that can be found in our Human Anatomy and Physiology textbook. The first one is comminuted, the breaking of a bone into 3 or more fragments caused by a high-impact trauma, and then spiral, which is a type of complete fracture, when a long bone is broken by rotational or a twisting force, most common in athletes, and then depressed. This is a result of a blunt force trauma, maybe from a falling object. This usually occurs in our cranial bones. And then green stick. This is a partial fracture, which means one side of the bone is broken. And then epiphyseal. Occurs when the epiphysis is separated between the shaft of the bone and its growing end. This is more common in children because their bones are still growing. Lastly is compression. When a bone in the vertebrae is flattened or crushed, more common in the thoracic spine. Osteoporosis is the leading cause of this fracture. Physicians can identify the type of fracture by doing an X-ray, MRI, or CT scan. X-ray detects broken bones and dislocated joints. MRI creates a three-dimensional image of the body parts, while CT scan provides a cross-sectional image, both horizontal and vertical. So with Joshua's case, they only did an X-ray. The doctor finds out that his right ring metacarpal is completely broken. Fortunately, it was non-displaced. His diagnosis is a spiral metacarpal fracture. And then, treatment. Splint or cast is used to immobilize the fractured area to prevent further injury. And medication is given to reduce the pain and inflammation. While traction is a technique where the aim is to realign the bone by using ropes, weights, or pulleys. This is also done before operation to subside the pain. Lastly is the surgery, when the bone needs to be put back together and realigned using screws, rods, or plates. So with Joshua's condition, there is no need for operation. He just needs a splint for his finger to immobilize it. Bones will eventually heal itself, and with a simple fracture like in Joshua's case, the bone will be healed in these 4 major stages. The first one is the formation of hematoma, where blood clots occurs at the site of the break, while phagocytes will begin to kill any germs or bacteria that might have gotten into the fractured area. And then, fibroblasts and osteoblasts enter the area and begin to reform bone. Fibroblasts produce collagen fibers that connect the broken bone ends, while osteoblasts start to form spongy bone. The fibrocartilaginous callus, which is a soft callus, will connect the 2 ends of the bone and stabilize it, while new blood vessels begin to occur. The third one is that this fibrocartilaginous callus, which is the soft calluses, will eventually be replaced by bony calluses of the spongy bone. Lastly, bone remodeling happens. Compact bone will replace the spongy bone, while osteoclast will break down extra bone around the fractured area. The fractured bone heals and bone tissue is created the same as the original one. When Joshua went to the hospital to get another X-ray for his finger, luckily his bone healed properly without any complication or infection. He was able to move his finger after 8 weeks, but with some restriction, like no harsh force is to be applied. Bones are very important for the proper functioning of our body, and safety must be observed at all times to prevent fracture. However, when you are not able to avoid it, make sure to go to the hospital immediately for proper assessment and treatment.